Welcome to this short educational film for carers and older people. This film presents information and tips about preparing to go home from hospital and being home after hospital. The film is written by carers and older adults. It includes a family meeting. Family meetings don't always occur, but they can occur when people are on rehabilitation wards. We hope that you will find this film informative.
Hello, my name is Miranda. My aunt was in hospital and now is discharged back home. Carers are anyone who supports an older adult at home without being paid. Carers are usually family and friends. Going home from hospital can be an anxious time. Being prepared to go home helps to calm the older adult and carer because it helps to know what to expect. Supporting an older person to go home from hospital can be frustrating for carers, particularly if it is their first time. Their care needs may have changed and they may need more support. You may not know what you're going to do or how to access follow-up support at home. You may think that you can do all of the older person's care yourself on behalf of the family, especially Asian people who may not want to bother anyone. I used to think I will look after my family member myself. It is easier for me. But then I thought I can have help as well. Why not? And then I start ringing up my aged care and I got great support. So it is really helpful, especially now. My aunt is in the wheelchair and every morning I have someone to come to help my aunt. 1 hour, it means a lot. Being well prepared is important and preparation starts in hospital. Kind reminder, carers can start to talk with hospital staff about discharge planning early and as soon as the older person is admitted to hospital. Make arrangement for help and support at home before leaving hospital. It can be hard to follow up community supports when at home. Carers can access support for carers from the carer gateway. For carers from non-English speaking background, the interpreter is a bridge between the health practitioner and the patient. You can ask the doctor, nurse, social worker, or any other staff for the interpreter in person or on the telephone to help you ask questions and get prepared for discharge. A checklist is an easy way for the carers to get ready to take the patient back home and not miss anything. The carer can fill in the checklist themselves with the older person and with the help of the hospital staff. Carers can find the checklist as part of the booklet about getting ready to go home from hospital. The booklet also has written information that may be useful for carers.
Carer support is very important for older people when they go home from hospital. Making a plan to go home and to be at home safely is also very important. Interpreters can help with communication. Interpreters can help over the telephone or in person. Family and carers of older people preparing to go home from hospital can ask us for advice. We can provide information and also help get other health practitioners involved if needed. Doctors like to know what carers do to support older people at home. Doctors can ask carers to explain this so that they understand what is needed and make a better plan for going home from the hospital.
Nurses help older people and their carers to go home from hospital safely by connecting them with other healthcare professionals to make good plans. Nurses can help with any education about nursing care that needs to continue at home. Do either of you have any questions or concerns about returning to home safely?
I don't know how to help mom to shower, and I also need help with cleaning the house and shopping, this kind of stuff.
Well, our occupational therapists can show you how to shower mum at home and can provide you advice around going out and undertaking shopping and getting the things that you need. They can also help you access services through My Aged Care as well if you're interested.
Occupational therapists help older people to go home from hospital safely. They can help plan for equipment you may need to be at home easily. They can help you learn how to move around the house and do day-to-day activities safely, like having a shower and preparing meals. Social workers are like a bridge. The social worker can help carers to understand available choices, such as respite in a nursing home and rehabilitation care. The social worker can follow up with other allied health staff and explain about how to access more support at home. Carers can ask the social worker about transport services to help get the older person home. Carers can ask about having an aged care assessment and about services and supports provided by the government through My Aged Care, such as allied health services and aged care packages.
Make sure that you get a letter from the hospital doctor before discharge to take to the GP. This letter is important to explain the patient's condition. Medication may change in hospital. The hospital will give 1 or 2 days of medication at discharge, and then carers and the older person need to arrange to go to the GP and get more. Remember that carers and older people can ask about medication packs, where all the medications are in compartments in the pack, and this can make life a lot easier at home.
Carers and older people can ask for a medication pack. Auntie was discharged and they packed everything inside a medication pack for all of her morning, lunch, and evening medicines. The description of all of her medicines was on the pack. I said, wow, that is really good. Before, I had to get this little container, pour it and give it to Aunt. I keep using the same pharmacy for medication packs. Just so easy for me. Less trouble, less headache. Go to the pharmacy in the community. They can have that special service and deliver the medication pack to the older persons at home every week. Carers can get hurt looking after older people. If your loved one needs to be lifted and helped to bed or to the toilet, ask the physiotherapist and occupational therapist in the hospital to teach you how to do this safely. If you need equipment to help with lifting the older person, ask the physiotherapist and occupational therapist to teach you how to use it safely. Kind reminder, remember that there is a lot of information about how carers can look after themselves on the Carer Gateway. You can ask the social worker and My Aged Care about respite services, including respite in the home to help carers to go out and do something for themselves.
It is very important to have the information ready and written down before the older person departs hospital. Remember that carers can note key contacts and telephone numbers on the checklist. Check any follow-up appointments at the hospital. My Aged Care, Family Doctor can provide support and advice for the older person and for the carer about their own health and well-being. Contact your family doctor about after-hours GP support. Carer Gateway, after-hours help, 000 for an ambulance and urgent medical care. Health Direct, 1800 022 222 for health advice from a registered nurse. Prepare to Care, Centre for Cultural Diversity in Ageing. Older Persons Advocacy Network, 1800 700 600.